Hi, this is Tim Obendorf, and today I'd like to talk to you about health savings accounts. You may be wondering what a health savings account is. Well, it's a facility to help people to take advantage of lower cost, higher deductible health insurance plans. And the idea is that it's a place where you can build up some funds to take care of unexpected medical expenses that might not be covered by your health plan. And they're limited to folks that are enrolled in high deductible health plans. And what that means is for 2023, a high deductible health plan has a deductible of $1,500 for individuals or $3,000 for families, or a higher deductible than those numbers. Unfortunately, if you're enrolled in Medicare, you are not eligible to set up or contribute to a health savings account. You can still have one that you've contributed to in prior years before you were in Medicare, but you can no longer add to it. And each year you're allowed to add for individuals up to $3,850, and for families, $7,750. And that's indexed, so it goes up a little bit each year, but basically $3,800 or $7,700 a year that you can add to these accounts and build up a nest egg to cover unexpected medical expenses. Now, you may be wondering, why do you need to set up a health savings account to cover these expenses? Well, the first reason is that when you make contributions to the account, you get to take a tax deduction. And in most states, it's state tax deductible, in addition to being deductible for federal tax purposes in all states. And then once those funds are in a health savings account, most HSA arrangements have the ability to invest those funds in a variety of investments, including stocks, bonds, mutual funds. And so as those investments grow, the earnings, whether it's dividends, interest, or market value growth, those earnings are tax-free. And then you can either take funds out currently. So if you put in money this year, you could take it out to fund medical expenses. But the most advantageous way to take advantage of one of these accounts is to let the account grow over time. And then eventually, whenever it is that you do take withdrawals, those withdrawals are tax-free as long as they're used to cover qualified medical expenses. Now, many of you may be familiar with flexible spending accounts, and one of the challenges with those is that each year you had to kind of figure out what's the likely amount of funds that I'm going to use up in the year to cover the expenses that qualify for that account. Well, with HSAs, you never lose the funds in that account. So if you put in funds in 2023, that account is yours, and those funds are available to you for 20, 30, 40 years into the future. And in fact, once your account is established, as long as you keep track of your medical expenses, any expenses that are incurred after the account is established, if they are qualified medical expenses, are able to be submitted to be reimbursed by that account. So it's a good idea to keep good records. And the way we see a lot of people use this is as a supplement to other retirement savings vehicles. So in their 20 years before retirement, they could build up a nice nest egg in this tax advantaged account. They've incurred expenses along the way. So, maybe some years it's $5,000 of medical expenses, some years it's more, some years it's less, but they keep track of all those expenses. And then in retirement, maybe over a 10, 20-year period, they submit those expenses to reimburse themselves. And they can use those funds now for anything that they need in retirement. Now, there are a lot of details about HSAs that we haven't covered here, but if we piqued your interest and you'd like to talk more about how this might apply in your situation, please give us a call or email us. We'd be happy to talk to you more about how this might work for you. Thanks for listening today. Bye-bye.